Regarding Ewing sarcoma, Ewing sarcoma happens to be second most common tumor in children. A genetic translocation that is 11:22 is, in some cases, found to be in 95% of the cases. This leads to formation of fusion protein EWSFL1. This can be identified with the PCR to differentiate round cell tumors from Ewing sarcoma itself. The X-ray shows a periosteal reaction and may give the onion skin, Codman triangle, or a sunburst appearance. It involves the diaphysis of the long bones, is a destructive moth-eaten lesion, poorly differentiated, and can look and behave like infection. Uh, Metastasis can possibly go to the lung. Treatment is neoadjuvant chemotherapy plus surgical resection and then again chemotherapy. Radiotherapy is also possible. Regarding the surgical prognosis, 60 to 70% long-term survival with isolated extremity disease.